This class may look like any other mums and babies group you can find around the country, but the charity that runs these sessions started them up to help one group of parents in particular.
You're bigger than me!
Mums in temporary accommodation, often they're in one room. Often in that room there's a double bed and no space on the floor for a child to crawl or to play. No space for an extra bed for an extra child. We see a lot of delayed development. We see a lot of very poor muscle tone. Actually, a lot of children are put in high chairs or they're left in their buggies for their own safety, because actually they're not safe in their homes. So, they're slumped in buggies for long periods of time, which means that they don't get the chance to use their muscles, and that will delay crawling and walking.
When people think of the homeless, they don't always think about children. But there are more than 124,000 children in England living in temporary accommodation with no permanent home. The numbers have fallen slightly this year, but it's part of a long-term increase. Rachel, not her real name, her husband and their toddler found themselves homeless after a problem with gangs and drugs meant they no longer felt safe where they had been living. Their fear about this means they still don't want to be identified in their conversations with us.
We had to leave, unfortunately, which made us homeless. So we ended up with family for a short period but couldn't stay there for too long. And then we were put in a hotel by the council. Well, it wasn't a very big room and there was a king-size bed and 2 single beds, and we had to put all our stuff in bags and put them on the beds because there was no storage space and he couldn't move around and play. My husband had to take him out into the corridor a lot so he could get some exercise and crawl up and down the corridor, and that's the only exercise he was able to get.
And were you worried it was going to affect his development?
Yeah, I was definitely worried. He'd started walking or trying to walk, and then while he was in the hotel room he wasn't able to do that, so he started crawling around again and like holding on to the beds and stuff.
There were no kitchen facilities at the hotel the family was staying in, and they say the cost of takeaways pushed them over the edge financially.
All we had was a kettle, and that's the only thing we had in the room to make food with. I wasn't comfortable with him having to have takeaway food all the time and constantly being on the phone to the council, practically begging them to move us somewhere, suitable, where we could, take care of him properly and feed him, better food.
I wanted to find out if Rachel's experience was unusual.
So all of these are our provisions that we get, our referrals.
So I went to meet Angie, a midwife in Oldham, who works with homeless families for the Shared Health Foundation organisation. They say that across the UK, some families live in B&Bs for up to 2 years.
What would you say to someone, they're not rough sleeping, they've got a roof over their head? That's enough, isn't it?
So generally, a hotel room is good for a night or 2, but if you want to try and provide for your family and provide a meal, bedtime routine, all of the things that we take for granted that are just easy to do, it becomes quite difficult in that situation.
After several weeks in the hotel, the family were told by Oldham Council they would be moved into a house just as Rachel was about to give birth to the couple's second child.
So when we got there, the carpets are in terrible condition, the mattresses full of stains and bugs, and everything was filthy. We found a rat in our newborn son's pram. Luckily he wasn't in it.
As well as being less than ideal for families, temporary housing is also an expensive option. We don't yet have data from all local authorities in England for this year, but Newsnight has analysed the data we do have, and it shows a 19% increase in spending on temporary accommodation compared to last year. We spoke to Oldham Council, who said they were sorry to hear of the family's experience and that they were committed to making sure that people are placed directly into suitable temporary accommodation. When we asked about the condition of the property, they told us each property is brought up to an acceptable standard in between lets and subject to an inspection before being offered to another household. Local authorities are required to ensure the accommodation they provide to those facing homelessness is fit for human habitation. However, they do not have to fully inspect a property, and there are no minimum standards for what equipment a property should contain for children. Experts say children are often missing from discussions about homelessness. What an adult might cope with, a child might not. Professor Monica Lackenpool is a paediatrician working on the Champions project, which is researching the impact of temporary housing on children's health.
So children living in temporary accommodation are living in crowded conditions, and that's one thing, and sometimes living in unhygienic conditions as well. So they may be sharing bathrooms, they may be sharing kitchens, and it's very hard for the mothers and fathers to sometimes keep those clean if you're sharing them. They may also be exposed to pests such as rats and cockroaches and other sort of pests that carry infections with them. So actually it is well known that there is an increased risk of skin infections, gut infections such as diarrhoea and vomiting, and respiratory infections as well.
What Monica told me reminded me of one of the families I had met at the mum and baby class. They are refugees who fled conflict in their own country and are living in temporary Home Office accommodation while waiting for their asylum claim to be processed. The mum, a trained nurse, offered to show me around.
When we moved here newly, it was even more worse. The place was really dirty. Sometimes there's even cockroaches. Yeah, insects, yes.
The kitchen is shared with a number of other households, and Mariama says even if she cleans everything, it can very quickly get dirty again.
So the children got sick because sometimes you have to left them to move and they will just pick up something, and because of the place is not proper clean, they were sick here. I even went to the went to the emergency when I just came. Yes, they gave him a treatment and they said he had infection because of the environment that we are living. So it affects his health.
The Home Office has a duty to provide housing for destitute asylum seekers. Its guidance says its accommodation providers should maintain furniture, equipment and utilities. We approached them about Mariama's situation, but in order to protect her anonymity, we couldn't tell them exactly where she lived, which they say would have enabled them to properly investigate. They told us, we were alerted to substandard accommodation, we will act, and said asylum seekers can contact a helpline which is available 24/7 if they have any issues to report. Mariama took her son to hospital because she didn't have access to a GP. Back at the Magpie Centre, Jane says this is a familiar story.
We spend a lot of our time plugging families back into their GP, into health visitors. All of those services are stopped every time a mother is moved from one temporary accommodation to another.
Jane says she's also worried that homeless children having to move at short notice can fall off the radar of health services.
When they continually move between boroughs and between catchment areas, that they can simply get lost.
And what's the harm of that?
I mean, what keeps me awake at night is that if we can't see them, if we don't know where they are, who is safeguarding them? Who's keeping them safe?
Trying to find out more about the experiences of homeless families in temporary accommodation has not been easy. We've spoken to lots of people who say their situation feels very precarious, and our interviewees only felt able to tell us about their concerns anonymously. But it's an issue that needs discussion. The potential risks to children of unsuitable housing were flagged in a report earlier this year by the National Child Mortality Database, which described it as one of a number of modifiable factors contributing to child deaths in the UK.
At its worst, a child who's in temporary accommodation, unfortunately, it has been shown from recent reports, could actually pass away, could actually die.
So what would you like to see change for children living in temporary accommodation?
Of course, you know, it's not easy to change that quickly. We can't just magic lots and lots more houses for these children, But there's a few key things that we can do. Environment, we could improve that, make it child-friendly, have some standards that we could say, these are the minimum standards for a child living in temporary accommodation. That's the first thing. The second thing is, when a child moves from city to city or borough to borough, if we had a notification system, we would know where those children are. We could then ensure that the services were ready to greet them, really.
We've heard concerns about the risks of overlooking the needs of children when it comes to temporary housing. Making them more visible could give them a brighter future.
Deb Cohen reporting there, and in a statement the Department for Levelling Up Housing and Communities said temporary accommodation must be suitable and safe, and councils have a responsibility to ensure this is the case, backed by government funding. We're reducing the need for temporary accommodation by preventing homelessness before it occurs, investing more than 800 million this year, 2 billion over the next 3 years to tackle homelessness and rough sleeping. Well, to discuss this a little further is the Conservative MP, Sir Peter Bottomley. Thanks for coming in, Peter. When you hear that there are 124,000 children in England living in temporary accommodation with no permanent home, do those figures surprise you?
They don't surprise me, but they're both large numbers and relatively small. If we ought to be able to cope with that in this country, if we can get people to work together, and if we can get the kind of attention which Deborah very rightly has given us in that comprehensive report. Tracking children is one important thing. We know it's important for children in care. We ought to care for the children who are still with their parents. We ought to understand that if accommodation is being offered which is not suitable, why don't we have a sort of a house rescue, the way we have garden rescues where the neighbours come in and make it suitable, and then welcome the family and give them all-round support straight away, so they aren't people alone only with statutory services. And for statutory services, if the people in them know how they could do it better, they ought to be able to tell their MPs, tell ministers, and we ought to get on with it. We're failing.
Yeah, but I mean, extraordinary to hear the care worker at the end saying, oh, you know, maybe we should introduce sort of minimum standards for children. I mean, we have a government that has a whole department called Housing, Communities and Levelling Up. If this isn't top of Michael Gove's inbox, you sort of wonder what is.
I think it will be by tomorrow. And I think that if someone can give the transcript of this programme to the Prime Minister's office, can this be shared among the relevant departments, they'll start working together. There's a problem in departments of silos. Often you need the voluntary organisations and the media to bring them together. And just to go back, a little anecdote, my first political campaign was to get a child out of hospital where the parents couldn't get a home until the child was out of hospital, and the hospital wouldn't let the child out of hospital until they had a home.
I understand that, but essentially...
Those you can solve.
But they've already done the joining up. They've already said levelling up is a priority, housing's a priority, communities is a priority, and it's all under one umbrella with one Secretary of State. How are they missing something like this then? Well,
part of it's local government, part of it's national government, and the way to do that is to avoid budget shuffling. If the local authority, who have the housing responsibility, can get a pot of money, they can actually get people into a good home within a week rather than within 6 weeks, or 2 years, as the worst example. Yeah. But if the
which is, let's be honest, it's taxpayer-funded hotels, right? I mean, that doesn't make any sense at all.
And secondly, why should you only have a kettle? And for a start, for cooking, microwaves work quite well, and you can do a lot more own food preparation. There are practical things, but the organisational one, which is why you have an MP on rather than the social worker, is to say, why can't government departments work together? And the answer is they often need nudging by MPs and by media and by voluntary organisations. And I think that the result of this programme is that government departments will work together, both nationally and locally, and things will be better. If in a year's time we're down to 20,000 rather than 120,000, we've made significant progress.
That's good to hear. Thank you very much for coming on. Thanks, Sir Peter Bottomley.